You can have a wonderful relationship, a wonderful home, you can travel and all that, but you cannot enjoy your life if you do not have your health. And that's what we're excited about here at Still Point, offering people the opportunity to make some life changes so they can enjoy their health. We all know the importance of early detection, and that is one of the true benefits of thermography, because when our body is going to support the growth of a cancerous tumor, that tumor has to be fed. So blood vessels go to that area to feed the tumor, and then the tumor begins to grow, and that is called vascular activity. In thermography, the vascular activity distinguishes the difference between a fibrocystic mass, a calcification, or a cancerous tumor. And so it's not necessary to go on for a biopsy if there is no vascular activity. And additionally, the thermography can show a tumor when it's the size of a pinhead. And if you, with mammograms, typically it cannot image a mass until it's the size of a pea. And at that stage, you might have had the cancer for 10 years and you could have over 1 billion cells.
I had gone the traditional route. About 35, I guess, I got a baseline mammogram. 40, I got another one, 45. And like most women probably, I always dreaded the experience. It was uncomfortable, it was painful, and in addition, I have had some problems with fibrocystic breast disease, which made the interpretation more difficult, which meant that they sometimes had to do the mammogram 2 or 3 times in order to get a clear reading.
Well, I had a mammogram in my early 20s because I had a suspected area, and I was reluctant to have that, but I needed to, according to my doctor, and I found it very painful and intimidating to have it done. So I didn't want to go back and repeat that, being I turned 40.
Having had the bilateral mastectomy, my options are now limited to an ultrasound, a CT scan, and I'm not interested in either. I've been through that, and I think my body has been damaged enough through the radiation from those procedures, and I am just not interested in going there again.
The more radiation you have, the more chances of having cancer. So it's like, okay, let's not put something in my body that's going to start making cancer.
The process of thermography is very simple. We do not touch you, we do not radiate you, and we do not really even have to look at you. So a woman would disrobe and sit in front of our camera in a very safe and secure environment, and I will be looking at the computer screen. The doctors are very specific about the images that they want, and we have 6 images for breast, and it's straight ahead, perpendicular, oblique, which means we do each breast individually, and then we do the back as well. It takes about 3 or 4 minutes to do the imaging. We additionally will have you fill out a health questionnaire, and we'll go over that in case you have any concerns or any issues or specific areas that we want to address to the doctor. We'll go over the report. When the patient leaves, then I will fill out the report on the computer, attach the images, and encrypted email it to MediTherm, who distributes it to their doctors, who are all licensed United States medical doctors certified in thermography. Typically, the report is read within 24 hours, and then we get it back to the patient within, generally within a week.
When I was introduced to thermography at Still Point, it was a blessing for me. It was a relief to my mind to know that there was something I could do to help myself know that I was okay.
It can actually show you much further in advance areas that might be of some concern to you.
It gives a better picture of what's going on, rather than just zeroing in on certain areas. It gives a total picture of the whole areas, including your lymph nodes and also the thyroid area by looking at the back of the neck as well. So that was helpful to me because there is a connection between your thyroid health and breast health.
June sets you at ease. She explains to you the process, what's going to be done, how it's going to be done, and it's very low-key.
June, bless her heart, is constantly looking at the monitor, which is away from me. She tells me which way to turn, right, left, up, down, to get the views she needs necessary.
It didn't have the pressing of the breast and hurting afterwards. And if you do have a tumor in there, I've always heard, that pressing could make it worse. So this is, this is nothing. This is just sitting there and It takes less than 10 minutes. It's wonderful. It was easy.
It's not a high pressure thing. You work at, positioning yourself well, you're warm, you're comfortable, and it makes the entire experience much better.
The thermography was easy, so much better than a mammogram. So much better, so much more comfortable, so much more relaxing. The report to me was very informative. It gives me a great baseline for where I am now, where I'm going to be in 3 months, 6 months, a year. I can see it myself. I have the knowledge of the doctors who look at it and prepare the report for me. I can't say enough about how wonderful and mind relieving the thermography was for me.